All right, welcome back to help you. And this series is gonna be over the elbow. So more specifically, it's gonna be over the outside portion of your elbow, also known as lateral epicondylitis, or they'll just term it as tennis elbow. This series consists of 3 videos. The first video is gonna be this introduction that you're currently watching with some self-testing to figure out which path you may need to take regarding your elbow pain. So here we go. When it comes to the outside portion of the elbow, you have muscles that come to one junction that attach to the bone, and that's called your common extensor tendon. Those muscles attach here, and a lot of times if those are undertrained, overused, or the tissue, the muscle tissue itself cannot tolerate the amount of load or stress that you're putting on it, so it becomes inflamed, sensitive, and painful. But the problem is, what if that lateral elbow pain was caused by nerves somewhere else along the spine, whether it be from an irritation down in the wrist coming up or more of an irritation from the neck coming down? How would you know? Just to let you know, this is not medical advice. I highly recommend you be evaluated by a medical practitioner or professional so they can find out what's truly going on with you. Let's go over one test that you can do to rule in or rule out nerve irritation. So let me be clear, this is not gonna be a very specific, sensitive test because, one, it's just you performing it on yourself. This is a test that clinicians would perform on you, which would give them information on a possible source of the pain. So let's say you have that lateral epicondylitis pain right here. It's kind of swollen, it's a little red. It's not an infectious type, but more along the lines of just irritation. So let's first check test number 1, and it's called your Sperling's test. It's to see if, hey, are you having radiating symptoms down into that lateral region of the elbow or that outside portion of the elbow? Let's test it. So here's how you do it. Stand up with a good neutral position. So on this example, we're talking about my right arm. So I'm gonna turn to the right. Now I'm gonna assess as I'm looking this way. Do I feel any reproduction of that similar, familiar symptom of pain that you get in the elbow? If no, then you're gonna move on to the next step. If it's a yes, you don't have to move on any further. So let's say you answered no. You're gonna turn your head to the right. Now, bring your ear down towards the shoulder blade, towards the back. What happens? Take note. Do you get any symptom that increases that familiar pain that you have in the elbow? If the answer is yes, that means you're having a nerve irritation somewhere up in this region that's causing a radiating pain down into your elbow, mimicking lateral epicondylitis or lateral elbow pain. I would highly recommend being seen by a medical practitioner. Come see me at the clinic, your choice, but nonetheless, be evaluated to find more in detail what's going on. So now for my people who did say, nope, I did not have any reproduction of elbow pain when I did the Sperling's test, let's move on. So here's test number 2. And here we want to look at the mobility of your elbow. Can it bend? Can it straighten? Can it rotate up? Can it rotate down? But here's a quick and simple test that you can do to see if, hey, are you cleared with mobility or not? So the first thing is, can you bend your elbows all the way up and touch your shoulders? As you can see, I have a lot of elbow bend, which is good. This is considered normal. As long as you get here, it's considered normal and you shouldn't be having any pain with it. If you straighten it all the way, can you get your elbow straight is another part of this mobility exam. Mine, 0 degrees. I don't have the normal hyperextension where my wrist would go lower than my elbow. But for me, I'm at 0, it's considered normal. So are you stopping, can't get your elbow straight? That means you possibly have an elbow mobility problem that needs more attention. So go get evaluated by a clinical professional and move forward from there. Now that you've already done the 2 tests, if you are both negative on those 2 tests, I would recommend that you move forward going along the category of muscle performance. So you'll find out in my next 3 posts, I have a lot more content coming to you regarding that lateral outside elbow pain. Stay tuned, I'll see you in the next video.